First Edition continues this half hour looking after your heart health in honor of American Heart Month. Heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 34 seconds in the United States from cardiovascular disease. And with us this morning, we have Dr. Thomas Alexander joining us live. Thank you so much for being with us this morning and talking about heart health. We appreciate you. So what is heart disease?
Heart disease is any disease that affects the heart. That it could include the arteries, which are the pipes that supply blood supply to the heart. It includes the heart muscle that causes the heart to pump. It could be electrical, which could be the atrial irregular heartbeats, arrhythmias, and all of that. So all of that is the disease of this causes the #1 cause of death in the United States and all over the world.
How is heart disease diagnosed?
So diagnosis of heart disease, initially the symptoms. So if you have symptoms of shortness of breath, chest pains, blackout spells called syncope, you probably should see a heart doctor. Tests that you can do include an EKG, which is electrical tracings of the heart. We can also do ultrasounds of the heart, looking at the heart squeezing. We can even do x-rays of the heart, looking at the heart itself on x-rays. We can inject dye into the heart, which are the arteries of the heart, looking for blockages, cardiac MRI, cardiac CT scans. These are all tests. So we've got a lot of tests that can help us diagnose heart disease and prevent heart disease from getting fatal by treating it.
When should someone see a doctor?
If someone has symptoms. So if you have risk factors for heart disease, like diabetes, high blood pressure, elevated cholesterol, overweight, you probably should see a primary care doctor. If you have symptoms, chest pains, blackout spells, new onset shortness of breath with exertion, you probably should see a heart specialist or a cardiovascular specialist.
Dr. Thomas Alexander, thank you so much for joining us live this morning and talking heart health. We appreciate you. Thank you.